device. We looked at Schirmer's, non-contact TBOT, tear meniscus height, and aberrometry in these patients. So this is our imaging modality called the thermography device. It's a handy thing. You can see it's attached kind of like an applanation mount, the gray box, which images the ocular surface. It gives you a thermal profile of the ocular surface, and it can capture in a restricted blink or in a continuous blink mode. It has a color scaling kind of like a pentacam, where the cooler colors are represented in blue, the warmer colors in red. And we looked at parameters like the severity, which is the score derived from the convexity and the compactness of the ocular surface thermal profile. We also looked at the ID app. This is a freely available app on the Android system which we have developed. This has blink reminders, so it tells you when to blink. You can set this as fixed reminders or smart blink reminders, where it actually looks at your blink pattern. If you're not blinking completely or blinking too slowly, it will actually remind you to blink. This is a video demonstrating the same. It can be installed on the PC as well. What you can see is you can have this icon which blinks when you're not blinking properly. There can be an audio which is turned on and off, so you don't necessarily have to look at that icon. And this blink reminds you to blink at the correct moment in time. It also has a 20-20 rule built in, which tells you to take a break every 20 minutes for 20 seconds and look at a distant object. So coming to our results, when we looked at the blink kinematics, we saw that the blink rate, the blink duration, the interblink interval, the partial blink percentage, and the thermography severity scores all showed improvement, although the partial blink percentage was the only one which reached statistical significance. In terms of the traditional tear metrics, the Schirmer's did not show any significant change. The non-contact TBOT, the lipid layer thickness, the spherical aberrations, the corneal higher order aberrations, the tear meniscus height, and the OSDI were all significantly better in post-intervention eyes. Now, we also tried to look at how the OSDI changed after the intervention, and what this graph essentially is saying is that patients with mild and moderate OSDI scores shifted towards the normal OSDI scores after the intervention. You can see the percentage of normals has gone up, the mild and moderate have gone down, so it does help in mild and moderate conditions, severe not so much. Future directions is to use this. It also gives you information of how to do warm compression, lid hygiene, etc. It has a visual acuity test built in, and to integrate all this as a composite solution. So the limitation of our study was it was a small sample size, shorter follow-up duration, and the app is not available on the iPhone. What was known is that computer vision syndrome is a growing public health issue. Our study adds that ensuring blink hygiene, improving objective and tear metrics without pharmacological intervention can be done with this. As the app is available on smartphone as well as desktop, it can prevent development of more severe dry eye and help reduce severity of evaporative dry eye. Thank you.
It's an excellent app, Dr. Rushad, that you've developed. Just that the sample size, I believe it's too small to actually extrapolate it to a larger population, but I'm sure it's going to help, and it is the upcoming thing in the future. Would you like to add?
Yes.
Is this app chargeable or?
No, it's free. It's freely available on Android. You can go to Play Store and
What's
download.
The name of the app?
ID, EYED.
D.
D. And so I think I can. Okay, the presentation on EYE and D. It's
Okay.
ID basically.
Okay. So this has to be downloaded, and it is there on your phone.
So you can keep it on the phone. It can, even if you've not got the screen on, it will give you an auditory reminder to blink. You have to just enable the thing on the phone. Once you've downloaded it, you can switch it on, and
Okay.
it will continue to tell you. You can also switch it off. It will continue to play over your other apps and other things that you're using on the phone. So it doesn't have to be on specifically. It can continue to run even if you're doing something else on your phone or on your device. And you also have the desktop version of it, which would also be
Also from the Google Play Store.
Yeah, it can be downloaded on.
But not available on Apple.
No, not available on Apple right now at least.
Thank you. Nice
Okay.
presentation.
Thank you.